Hello everybody, my name is Küntscher. I'm the head of the Department of Plastic and Hand Surgery here in Berlin, in the German capital, in the Elisabeth Clinic. I also run a private hospital which is situated in the north of Berlin, in the northern border. The plastic surgery department here at the Elisabeth Hospital is one of the three biggest departments in our capital, Berlin. We do 450 transgender cases, gender refinement surgery cases a year. We decided for a new microscope basically because our previous microscope was quite old. It was already 10 years old, and then I went into the market and checked what the companies offer. And I also wanted to have this fluorescence dye, not just for microsurgical cases, but also, for instance, for breast surgery. In some patients, we do have to perform subcutaneous mastectomies for prophylactic purposes, because in their breast glands they have not a manifest cancer, but they have some kind of pre-existing diseases that can cause cancer in the future. And in these patients, they have a genetic disposition to breast cancer, and in these cases usually it is recommended to remove the gland. But then we end up with very, very thin skin envelopes, and if the skin envelope is very thin, and if those young females have very thin subcutaneous tissue, we never can be really sure whether the skin is well perfused. And for cases like that, we would use not a microscope but only the dye function to check the skin perfusion before we put an implant in, a breast implant, a silicone implant. This gives us more information about the perfusion of the skin, or whether it is necessary maybe to remove a part of the skin close to the incision sites to get the poorly perfused skin off, to get a better wound healing later on. For microsurgery and for subcutaneous mastectomy and to get an impression of the perfusion of the skin envelope, it is perfect. We decided for this new microscope with fluorescence dye because it offers more safety in the OR. It gives you more information about the perfusion at the site of the vascular anastomosis, and also about the perfusion of the whole flap. And we can also use it in breast surgery. The main improvement using the Leica microscope with the integrated fluorescence is the IC dye fluorescence imaging that we can do right in the OR, as we've done today as well, because some of the transgender males are a little bit pale in the skin color, and we are sometimes not really sure whether the arterial inflow in the flap is perfect, and if it is good, we sometimes do not know whether all portions of the flap are well perfused. As we've seen in the OR today as well, when the dye floats in, we see some darker spots and we see lighter spots, and we get a very nice image how well the flap is perfused, beside our clinical science like refill and the traditional flap monitoring opportunities. When I experienced for the first time GLOW8 in red, it was wow, I see how the blood flows in the side of the anastomosis. The optical quality of the microscope is very, very good. It is so easy to handle. It is like you would drive a truck just by a joystick. It is very easy to handle. It has a very wide arc of motion, so you can be at the border of the OR with the microscope, and it brings, anyway, it comes right on top of the situs, and you see everything very nice. And it has this additional functions with dye. And I also like the two red points, and you bring them together, you know you are at the point of the best focus. as there are some nice features. The microscope has another advantage. If there is a perfusion problem, you can go with the microscope over the flap and check it again. You could even drive the microscope from the OR to the intensive care unit or to the intermediate care unit where the patient is, and put it on top, and you can see, okay, there is a good flow or there is a bad flow. And this could help you to decide whether revision surgery is necessary or not. The usual acoustic Doppler is not comparable to what this new microscope can offer us. Certainly not, because you get, with the Doppler, you get just the sound, you know whether there is an arterial signal or whether there is no arterial signal. But the new fluorescence shows us more about the perfusion details of the whole flap, not just of the side of the anastomosis. For instance, it is possible that you've done your arterial anastomosis, and there is a little technical mistake within the anastomosis. You hear an arterial signal with an ordinary Doppler, and you also have a refill in the skin, but you never know whether the arterial blood reaches really the distal zone of the flap, of the tip of the phalloplasty. And this is, we can image much better with the new technique, and in the past we were not able to image that. The use of the fluorescence dye doesn't help us to recover the patient faster, but it helps us to know at the end of the operation whether everything is fine or not. If you have pale patients or patients with a darker skin color, where it's the ordinary signs like refill and skin temperature doesn't help you further, it is a very, very good additional tool at the end of the operation to check whether there's everything fine. Two main improvements for the other staff and for the nurses are the screen. They can observe exactly when I sewed the microvascular anastomosis, they see when I did the first, the second and the third nut, and they knew exactly, okay, now he's doing the third nut or the fourth nut, and I give him the scissor. So they can better observe the process of the operation. And they like the easy handling. The new features are very, very nice, especially for us. We do not use them just in a clinical routine. We use the new features also for academic purposes. We have the screen next to the microscope. We can tape when we do the microvascular anastomosis. We can tape how the dye flows in and the dye flows out, and how the skin gets enriched with the dye. And we can also show, not just in the OR to our staff, we can also show in meetings, when we go to meetings, when we have speeches, we can explain to colleagues what we do. And I'm also doing students education. I'm a professor at the University of Heidelberg, and this department does online lessons for the Heidelberg students, and we can show them how we do the anastomosis, we can do the videos, and we can also visualize how perfusion works in a free flap. This is also very nice for academic purposes, for the training of younger surgeons or medical students. I believe that the use of a microscope with an ICG dye function is going to become more and more common in the future. I guess more and more plastic surgeons are going to use that in the OR.